Closing defects on the face can be very complicated and tricky. Today's patient was a 70-year-old man who came in with a basal cell carcinoma that bordered on the side of his nose, his cheek, and his eyelid. This is a very complex place. First, we drew out the skin cancer. Then, we anesthetized the patient. I took the first layer, brought it to the lab, and I noted that he had some skin cancer left behind between the 3 o'clock and then the 6 o'clock margin. Because I know exactly where to go, I went back and took one more layer on the patient. That second layer ended up being clear, and we were able to then close the patient. Once we have clear margins, we switch gears and we get into reconstructive mode. Because this patient's skin cancer bordered on his cheek, nose, and eyelid, we had to take into account multiple things. When closing a defect like this, protecting the eyeball is the most important thing. We need to make sure that anything we do doesn't pull the lower eyelid away from the eyeball itself. Because of that, we opted for an inferiorly based rotation flap, which means we slice down the side of the nose and bring up the tissue, attacking the deep structures up to the bone. As a result, we can close the defect without pulling any tension on the lower lid. At the end of the surgery, we injected long-acting anesthesia, so he's going to be pain-free for the next 72 hours at least. This was a super successful surgery. Not only did we get the cancer out with the tightest margin possible, we were able to close the defect with no tension on his lower eyelid. And as a bonus, all the incisions were hidden along pre-existing cosmetic subunits, like the junction between his nose and his cheek and between his eyelid and his cheek.